Addiction recovery treatment is already lacking in the greater New Orleans area. Now the announcement of 2 clinic closures has patients both wondering where they'll live and where they'll get affordable treatment. Meg Ferris explains.
I was tired of living the way I was living, and I have a family that I'm trying to reunite with, and you know, there's a lot of things going for me right now that if I'm using, I just don't have.
This man is in recovery for cocaine addiction, clean 4 months now. He says the transitional living program at Addiction Recovery Resources was making a big difference.
Living in a place and having some stability is a big part of, you know, the Getting Sober program.
But several days ago, local ownership changed hands, bought by out-of-state owners. And with that came the closure of the West Bank and downtown clinics. The Metairie and St. Charles Parish clinics remain open, but the staff is smaller and there's been a complete reorganization of all programs.
We will continue to see the people that admit to our services for their first year. But after that year, we'll be referring them on.
Former owner psychiatrist Dr. Ken Roy is now chief medical officer. He says the scaled-down business will move from more outpatient treatment to a focus on 44 inpatient Medicaid residential treatment beds. So they're helping people on long-term medicine treatment find other prescribers. But it's not easy with the lack of services in this market and the lack of doctors who take Medicaid reimbursement for addiction treatment.
They're the poorest people, so they sometimes have trouble accessing that care.
Some in recovery tell us they're concerned people will relapse. As one patient said, former users are always looking for an excuse to use again. Meg Ferris, Eyewitness News, Medical Watch.
Addiction Recovery Resources says patients should call for help with referrals.